take a look at this photo. You probably noticed his missing tooth, then his missing brows. Did you? So stick around to find out how you can protect your teeth and prevent it from falling off. Improve your dental care. Say no to plaque. You can do that by subscribing and click on the bell notification to keep you updated. In an ideal situation, if you brushed and flossed ever since you got your first tooth perfectly, and also you have perfect diet to optimize for your teeth's health, then brushing and flossing should be enough to prevent your teeth from falling off. But come back to reality for a sec. We don't do any of that. I'm sure some days where you forget to floss or brush your teeth. Also, there are many days where you want to just relax and eat a junk food, ice cream, candy, whatnot. We're not perfect. I'm pretty sure there are a lot of people out there who don't brush or floss properly, and we're gonna miss some areas on our teeth, meaning that we're gonna have buildups of plaque, and once these buildups of plaque get into the spaces that our tools like toothbrush and floss can't reach, then it's just gonna stay there and then continue to grow. So what do you do after that point? Take a look at this picture. All you need to focus on are the three things, and they are your teeth, your gums, and your bones. Now, these plaques will get into spaces where our brushes and floss have a hard time reaching. And since we have a hard time reaching these plaques to get rid of, they start to build up and get hardened, very hard. And once they become hardened, that's what we call tartar. Or another word is calculus. And no, I'm not talking about the math calculus where you have to learn all these equations. No, none of that. But these are plaques that became hardened and just stays on your tooth. Now, these are very hard to get rid of. You've probably seen it on your tooth, like still yellow stuff around the gum line. And you think they might be staining, but really they are calculus. And then you try to get rid of it with your toothbrush and it doesn't come off. But I'm sure you have seen these videos somewhere on YouTube, Instagram, where they move these huge ass skunk off their people's tooth. Those are calculus. They don't just stop after they get hardened. No. They continue to grow and build on your teeth, and it will start to irritate your gums, and it creates pockets within your gums. As it grows, it's gonna slowly get closer and closer to the bone that helps to support your teeth. And your bone doesn't like that. They'll be like, oh no, we don't do that here. So the bone will slowly just move away from those calculus bacteria. It will just keep on running away because they're scared and they don't like that. So they're gonna run away to the point where it's gonna reach to the end of the tooth where the tooth don't have any support because the bone ran away and it's not supporting the tooth anymore. This will lead your tooth to wobble, and this will eventually cause you to lose your teeth. So we use a device called probe. On the probe, it has a measuring stick like a ruler. So it tells us how deep your space or pocket are and if your bones are actually supporting your tooth very, very well. So on a normal person, it's about 1 to 3 millimeter. However, if you go over 7 millimeter, that means that your bone pretty much ran away and reduced it down to the point it's very close to the edge of the tooth. Not only that, you probably know because your tooth is gonna move. To prevent these plaques and calculus to scare away your bones and eventually for you to lose your teeth, what you gotta do is make sure you keep up with your oral hygiene, like brushing and flossing. Make sure to brush minimum 2 minutes, and also make sure to hug your teeth when you're flossing. Most importantly, you gotta go see your dentist. Normally every 6 months, twice a year, or minimum once a year, please. Because then you can check your status of your teeth and your dentist will tell you, oh look, you got some calculus here, a small calculus, or maybe you don't have any. And if you do have some calculus, your dentist will tell you to go see a hygienist in the same clinic to get those removed, because you can't remove those calculus with your toothbrush and your floss. So that way your bones won't run away and then continue to support your tooth and then hold your tooth and preventing you from losing that tooth. If you want to learn more how to keep your teeth healthy, you can check out my other videos over here, and give me a thumbs up if you like this video. And if you're new to my channel, why don't you consider subscribing by clicking on my face, and that way I know that you're smiling daily. And until next time, peace.